Hi there, this is Kim McLeod. I'm facilitating today's topic at One More Thing Live. Today we're going to talk about emergency care plans and advocacy cards. I'm joined by Kelly and Julie, and we are three moms of special needs children ranging from low special needs to medically fragile, crazy complex needs. So we span the range of what special needs means. We're parents. We're here to share and support each other through parenting special needs children, and we are not professionals. We are not here to substitute for legal advice, medical advice of any sort. Please always consult your professionals and your care team before you make any decisions. All right, thank you. Thank you both for being here today. All right, so let's begin with the emergency care plan. This is a document that can be very helpful whenever you have to go to an emergency situation like the ER, emergency department. Why does it say ER? Emergency department. What does ER stand for?
Emergency room.
Thank you. There you go. Terminologies you use so often and you just don't even think about them. So, Julie, you go ahead. Start with the emergency document, care document.
Right.
What that is, how it works.
Experience with an emergency document, or sometimes it's called a care coordination document or a care plan. It's also been talked about as a single
point of care. And Julie has just been frozen. Okay. You'll have to repeat that last piece, Julie. You froze.
I froze. I'm sorry. So I'll just quickly, it's got different titles, but essentially a care coordination document or an emergency care plan includes a summary of information about your child that's going to help the care provider in that situation get up to speed quickly on your child, so that they can help them in the best way possible with the most salient and succinct information. If you have a child who's quite medically complex, technology dependent, fragile, has been in the hospital frequently, they're going to have a very big chart. And even with electronic health records, it's difficult to get a good solid picture of that child in a very quick timeline.
Okay. Let me just pause you there, because I want to ask Kelly about the advocacy card so that we have a comparison of these two and where we use them. Okay, so Kelly, can you tell us a little bit about the advocacy card?
Sure. The advocacy card is a very similar purpose to what the emergency care plan would be, which is a snapshot, a quick reference of information that would help this person, this provider, this teacher, EA, clinic doc, have a quick understanding of your child. An advocacy card isn't typically used in the context of an emergency. It's more when you're trying to seek a particular service or change a particular service or add something different to a service that you're getting offered. And it is an overview, but it's really specific to the service that you're trying to improve upon for your child. But it would include similar kinds of information. It would include a brief history, an overview. It would be key pieces of information like in the school setting, it would be key learning strategies, key elements for success, and that kind of thing.
So if you have a new EA, a new teacher, a new anybody, this is a great reference material for giving them the orientation to your child.
Yeah, often like a medically complex child that has a huge chart, a child in school is going to have an IEP, an IPRC, an OR, Ontario School Record SR, and quite frankly, the EAs and or teachers, and even sometimes, the staff mandated to be, reading that document don't have time. They don't necessarily go through it all, or there's new information that you want to be able to share.
Mm-hmm. In our previous video, Kelly, you said that it's a one-pager.
One-pager.
Okay, Julie, how large can an emergency care document be?
So I think that's going to depend on the complexity of your child. In my experience, ours has been quite lengthy. It's been 3 to 4, sometimes upwards of 5 pages. I'm not sure that is the best approach. I agree with Kelly that a one-pager at the very front with the key information. So on on the front page for ours, we would have who her most responsible physician is. We would have her healthcare card information. They want that number, they want the address, they want the parents' names. Then I would have on their emergency phone number. I'd have any allergies or any special considerations. If the VAT team has to be called, the venous access team for your child, that would be on that front page. If you know your child's baseline vitals, and that's important information, you would want to have height, weight, blood pressure, where their typical oxygen saturations are. You'd want to have that on your front page. And then you want to have a really brief summary. What this child is about, what their medical condition is, what the key medical complexities are, what technologies they have. So that's page one, and it can be fit onto one page. And then from there, yeah, go ahead.
Sorry, I'm sorry to interrupt you. So that would be a great quick document when you call the ambulance. It'd be a great quick document when you show up at the emergency room. Might not be the document you're going to share with your teacher or EA at the school.
Exactly.
It would be helpful with the school nurse, but not really the same kind of information you want to share in that forum.
It's different information, and we've also developed what Kelly's calling an advocacy document as well for our daughter. So we also provide the medical, the emergency care plan, or the SPOC, or whatever the parent is calling it, or the professional is calling it. But we also have that advocacy page as well, because it's an essential tool to deal with the school team. The other pieces that would go into that emergency care plan or the coordination plan would be things like a backgrounder. So oftentimes you're asked the medical history of your child, and most parents will say over and again, I've been asked my birth history so many times of my child. I've been asked, what was the delivery like? You can put that kind of thing in that background piece, and if you don't care to share that story at that particular moment, you can ask them to refer to the document. And it's very easy to do. You can do the summary of your child from year 0 to, in our case, year 8, and a very, very short overview. The other things that are important for that document: what specialists and what clinics your child is seen by. Medications, you need to have a list of medications. It's got to be up to date, and you are the best person to keep that up to date in consultation with your physicians.
So, list of medication, I just wanted to put a quick piece in there. Anytime that you get a script from the pharmacy, it has these little squares on it, and it lists the last month or 2 months, depending on how many medications you get. And I just staple those to my document. And I just keep adding them every time I get some, so that the list is there and it's current, or as much of the current part. And if anything, it also lists the pharmacy so that they can contact. The hospital pharmacy can contact the community pharmacy.
And I would add to that it's really, I think it's very important for the parent to be very much on top of medication. So even if your primary care provider or your most responsible physician is the one who's maintaining this emergency document, you need to look at that and make sure that everything there is up to date and is exactly as you're administering it. Liquid versus pills, check the dosages, make sure that the name is right? Generic names versus brand names, very, very important, especially if you've got a highly sensitive child to different medications, or you're dealing with, very volatile medications, narcotics or anti-seizure medications, those types of things.
Right. The other thing I want to know about was who can help parents put these documents together. Kelly, can you start with that?
So I got the template for my son's advocacy card from a friend who's a special needs teacher in a different school board than my son, and I just adapted it. You can have people who have had similar experiences share their experiences. There's websites, there's sometimes forms, and Julie can speak to this, that the hospital has generated that you can have a part in filling out. You need to be creating something, though, that is something you can maintain and something that you can update and something that you have the capacity to keep current, because then otherwise it's not useful.
Okay, we've got 2 minutes left. Julie, who would be able to help on the more medically complex form?
Well, I want to first say I agree with Kelly. It's got to be a shared responsibility, even on the medically complex side. So it depends if you're involved with a program such as a complex care program where you've got a nurse who's facilitating the maintenance of that document for you. You still need to work with that person to make sure it's got the information that you understand, because you're going to be the person who's at emergency, right? So it could be a most responsible physician. It could be your pediatrician. It could be a specialist, so if your child has primarily a neurological issue, it might be your neurologist. If you primarily have a gastrointestinal issue, it's your gastroenterologist. So seek out that primary care provider that has the most important information about your child and with whom you've got a good relationship. And the last piece that I would add to that document as well is a list of recent interventions or surgeries. So it's important for people to know what types of interventions have been performed on your child, when they last had an anesthesia, as well as any issues with anesthetic.
Yes, that's important, and a lot of people don't think about that piece unless you're in the middle of that, right?
And it's really hard to in an emergency situation or a stressful situation to recall when was that last surgery and when was that G-tube placed, and I can't remember the last time that they went under anesthetic for an MRI. Mm-hmm. One thing that we've done also with our emergency care plan is developed a very small card that we attach to our child's stroller or to her chair in our van, so that if we have an emergency and either the parent isn't immediately there or a caregiver who knows them well is not there, then the emergency personnel have a piece of information that can lead them in the right direction to get good information about your child.
That's a good idea. And the other one I wanted to suggest too is I was thinking about with that emergency information is, as my child gets to be a teenager getting ready for transition to adult care, you know, I've realized that technology has played a big part, and the new iPhones have a emergency medical section, you know, which is becoming more prominent for a lot of people, and for children who are managing communications. They have that technology available also to carry their medical information with them. Mm-hmm. Kelly, any last words?
Just that I think the two documents that we've discussed today can be used in very different ways and under very different circumstances, but the intent is the same. It's to bring those that are trying to help take care of your child into the loop and to understand that child as best as they can before making any decisions about how best to support them. It's about bringing those providers up to date, up to speed, with information that they need and they're going to want in order to make good decisions for your child.
Fantastic. So, ladies, who is the expert in your child?
That would be
the parent. Yeah, the parent, yes. Mom or dad or the most responsible caregiver. It's the parent, and you need to treat yourself and respect yourself as the paraprofessional that you are.
Awesome. Thanks, ladies. We'll see you again next time.
Bye.
Bye.